Hi, I hope this video finds everyone doing well. I do apologize we were not able to get to being able to see the demonstration of the physical assessment, but I did just want to touch bases and go over a few pointers as it relates to the physical assessment, seeing as how that's our next skill that we will check off on. And we may have to readjust the topical outline, but we'll discuss it further. So looking at the head-to-toe assessment checkoff, just want to make sure that we're all understanding. There is a physical assessment chapter, I think it's chapter 21 in your fundamentals textbook. And so just wanted to talk through each section. And the best way, in my opinion, to review this information is to utilize index cards and to do it section by section. But just want to point out with checking off, I was able to assist with checkoffs for the freshmen and just want to highlight some things that I noticed. When we're doing an assessment, we can't just say words like good. Her vital signs were good. Her neuro assessment was good. What is good? We know that within normal limits, it's based upon what the patient's ranges typically are. After we've gotten a baseline assessment on them, then we can kind of say what's within normal for the patient. But just real briefly, just wanted to jump on to share in regards to as you're practicing some things that I would like to point out that you should pay attention of. Of course, the introduction is self-explanatory. The vital sign assessment. When you are doing your vital signs for your physical assessment, we will not actually perform vital signs, but you will have to speak to, and I mean tell us as it relates to the vital signs. Blood pressure. Are you doing a manual? What arm are you doing it on? When you're doing the radial pulse, are you doing the left hand? Are you doing the right hand? When you're doing temperature, what's the route? Are you doing oral? Are you doing axillary? When you're talking about respirations, you're going to say, well, the rate was 12 and her respirations are even and unlabored. I say even and unlabored because that's typically normal. So it's not just respirations are good. It's letting us know what respirations comprise of. And that's looking at the rate. It's looking at whether they're struggling to breathe. Is it, labored? O2 sat. Did you check the O2 sat? Was the patient just on room air? Do they wear supplemental oxygen? And then pain, of course, 0 to 10. If they said a 2 on the pain scale, when you're doing your assessment and you're practicing, if your patient says a 2, then it's up to you to further investigate where that pain is. How bad is that pain? You said a 2. What makes it worse? What makes it better? Is this something new? Is this something old? So just knowing in that vital sign assessment portion of the physical head to toe, you will speak to these things. When we look at the neuro assessment, you're asking the patient these questions. You're telling me or telling the instructor, are they alert, oriented times 3? What are those 3? They are alert and oriented times person, place, thing. Person, place, time, and situation. When you're looking at their scalp, you're not just going to say, oh, her scalp looks good or her scalp looks dry. You're going to say, well, no lesions, no lice are noted. Hygiene. Her hygiene is clean. We're not going to say good. When we look at pupils, PERLA is what is normally known as PERRLA, but for this assessment, we're just going to do pupils equal, round, and reactive to light. You're going to actually shine a pen light in their eye. If they wear glasses, you're going to have them to remove their glasses. That's an accurate way of checking that. You're going to ask, hey, do you normally wear glasses? Somebody may have contacts on. So do you wear glasses? Do you wear contacts? And then sclera, that's that white part of the eye. Sclera is white. Drainage, no drainage noted. If there was drainage noted, you would make note of the color, the consistency of it. Facial symmetry, you're looking at that face to make sure that the face is symmetrical. And when they smile, you're going to say, can you smile for me? And they're going to smile, and you're going to make note if it's even. If it's uneven, that's asymmetrical. So you're going to look at their facial features. When you look in their nose, their mouth, you're going to look at the mucosa. The mucosa should be pink and moist, whether it's in their mouth, in our nose. If it's reddened, that's an issue. That proposes an issue. We'll talk further about this assessment, but I want you, before you to begin practicing, to be able to be aware of what you're saying and doing. I will also post videos as it relates to what should I be hearing when I listen to their long sounds. When you're looking in their mouth, you want to look at their teeth. For myself, you would say gold-plated tooth noted, with an S on it, or whatever the case being. But your assessment is whatever your findings are when you assess that patient. You want to look and see if there's an odor to their breath. Do they wear dentures? With their nose, are they having any drainage? With their ears. You're looking in their ears with your pen light. You're seeing if they have drainage in their ears. Do you see wax present? Do they wear hearing aids? You're asking these questions as you're looking. Assessment, as we know, is inspecting, is looking, is asking questions. So with their speech, you can say, don't miss speech. Just because they've been talking to you the whole time, just because they've been answering questions, you still want to know on your actual checkoff that the speech is appropriate. If they have some slurring or garbled, you would note that on your assessment. When it comes to respiratory, look at the chapter that focuses on assessment. You're going to have to know those areas of where you're supposed to be listening for long sounds. I'll look at the pages and upload those pages also. But it's a sequence to that. You don't just place a stethoscope all over your chest. As we noticed, one side has more long lobes than the other. 2 longs, but the right has 3 and the left has 2. So you want to make sure you're covering all those areas and you're listening to them. So make note of, we're going to be looking at that. When you check anterior, when you check posterior, and when you check lateral, we're going to be making note that you're putting the stethoscope in the correct position. And then if it's abnormal, you'll speak to that. Cardiac assessment. We just got checked off on apical pulse. We were listening, but did we really pay attention if it was regular, irregular? Is it strong? What was the rate? On your physical assessment, you will have to speak to that. On the abdomen, you're going to ask or you're going to inspect. Remember the sequence of the abdomen. It's a little bit different. When you inspect, you're going to see if their abdomen is flat, if it's round, if it's distended. Do you see any scars? Do they have any tubes? If somebody has a peg tube, you would note that. When we auscultate bowel sounds, it's a proper sequence. You want to go right lower, right upper, left lower. You want to make sure that you're going in the right sequence when listening to bowel sounds. We're going to be paying attention to that. And when you're listening, you have to listen for up to 5 minutes. When you palpate, you want to lightly palpate. We don't want to deep palpate, but you want to lightly and ask them, hey, does that feel tender? Do you have any pain when I press down? Do you see any abnormalities when you're fit, or do you feel any abnormalities when you're feeling? And then you want to ask them, and a lot of people miss this when they were checking off. We want to ask them, hey, when was your last bowel movement? Okay. Was it regular? What color was it? We want to know all these details because we know that some of these can signify that there's an abnormality going on. We want to ask them, when's the last time you urinated? Is there any pain? Is there any discomfort when you have a bowel movement or when you urinate? What color is your urine? You know, and then we want to even ask, is there some vaginal discharge? These are all parts of the physical assessment. And then with upper extremities, we want to feel the bilateral radial pulses at the same time. Are they even and strong? Do you feel one that's going faster than the other one? Not necessarily meaning that they're even. We want to check capillary refill. We want to press and make sure that that skin color returns back in less than 3 seconds. We want to do bilateral hand grips, pushes, and pulls. So with grips, you're going to have them, hey, can you squeeze my hands? as tight as you can. You're going to notice if they squeeze the same amount on both hands, because if one is stronger than the other, there's something that potentially could be going on, could be late effect of a stroke or something. So you're going to have them to squeeze your hands. You're going to have them squeeze your hands as tight as they can. And if you want to do 2 fingers, that's fine. And then with the grips and the pushes and pulls, you're going to say, hey, I want you to push against my hands when I push against yours. You're going to push and they're going to push back. That should be speaking to their strength. When you be able to pull their hands, they're going to pull toward themselves. And that's going to determine if they have strength in their hands. That's going to determine part of that. If it's strong, if it's weak. When we do range of motion, you have to know that the difference between active and passive being that you're doing it for the patient, active is that they're able to do it. As long as you do at least 2 different range of motions. We went over those. If you do range of motion, if you say, hey, can you hold out your hands? Can you flex? Can you extend? Could you move your hands in a circle, circumduction? Could you wiggle your fingers? So we're asking you to do range of motion to see if they have that range of motion. Even in your upper extremities, can you do your shoulders? Can you move your shoulders? And just making sure that they're active range, that range of motion is, that they're able to do it. When we look at the lower extremities, you're going to pretty much do the same thing. You're going to check pulses. There are 2 pulses in the feet, and we'll speak more to that. You're going to check both pulses. On this sheet, you're just going to check the top one, which is the dorsalis pedis. And you're going to check them at the same time. Are they even and strong? You're checking to see both sides. We're doing both sides to make sure that they're strong on both sides, so we can notice if there's an indication of weakness and there's something neurological going on. So you're checking the capillary refill in the toes. You have to, in order to accurately do a full head-to-toe assessment, you will have to take your shoes and socks off. You can't check an assessment. You can't check a pulse generally or a capillary refill if somebody has their shoes and socks on. You're going to do bilateral pushes and pulls even with your feet. The same concept that you did with your hands. You're going to check to see if there's any edema, if there's any swelling noted to their ankles, to their feet, to their lower legs. You're going to have them to do range of motion in their feet. Have them to lift their legs up and down. Do the rotation of the feet. Wiggle their toes. Range of motion. You can review those exercises that we've already gone over. You're also going to look at their heel. You're going to look at their heel and do an assessment to make sure and see if it's red, if there's an injury there. Because a lot of times that's where a lot of pressure injuries or pressure ulcers will happen. And we need to be able to look at their feet. Mobility. On your form, on your checkoff sheet, mobility, switch those 2 around. Number 1 thing you should do is make sure that before they even stand up, are they steady on their feet? Are they dizzy? Do they feel lightheaded? And then you want to ask them that before they stand up. And then you'll ask, hey, do you need any assistive devices? Do you use a cane? Do you use a walker? And then you'll have them stand up and they'll walk for a certain distance and walk back, and you'll pay attention. Is their gait to one side? Are they wobbly when they're walking? And then with the skin, you want to check skin turgor. You want to see if their skin is tinting or non-tinting. And we'll discuss the reasoning and the rationales further, but just wanted to give an idea of what when these words are on here, what we're looking for. Seeing if it stays up longer than a few seconds. Skin color. We want to make sure that skin color is not discolored, that there's no discoloration. Some people have vitiligo, which is where the skin color is lighter in some areas. So you want to just make sure that you're looking at the skin turgor, the skin color. Do they have any skin abnormalities? Is there any redness? Are there any scars? Ma'am, do you have any tattoos? Do you have any wounds? Do you have any skin breakdown? Are there any incisions? And then you'll do your ending implementation. But the general number 3 on that says use appropriate terminology when speaking with the client. And again, this is just a summary of what we're expecting as it relates to the head-to-toe assessment. Again, I do apologize. We were not able to walk through and demonstrate. There is a video on Canvas. Feel free to review that. Please review that before tomorrow, and we'll discuss it later in class. You all have a good day.